Okay, we're going to get started.
Okay.
Thank you for coming out to North Texas Assisted Living Foundation, our continuing series on issues that relate to our mission. Our mission is to provide information to families who have family members requiring assisted living services. Today we have the first in a continuing series of presentations about the Affordable Care Act. We're going to get started. Hope everybody can see this. Can everybody see this?
I'm going to move up closer so I can see.
Okay. Okay, the Patient Protection and Affordable Care Act was signed into law by President Obama on March 23rd, 2010. In this presentation, I want to refer to Patient Protection and Affordable Care Act as ACA. The ACA attempts to fundamentally address problems related to domestic health care delivery system. The ACA attempts to address several fundamental problems with the present healthcare delivery system. Number one is to give Americans greater access to health care. Number two is to develop a plan for making sure that up to 37 million Americans who are presently non-insured become insured. Number three, we look to expand the present Medicaid program. Number four is develop state insurance exchanges so people can.
Excuse me, what was number 3 again?
Medicaid expansion program. They're interested in, the ACA is interested in developing Medicaid to expand the present Medicaid system. Number four is to develop insurance exchanges basically operated by the individual states. Number five is to place controls on runaway health care costs. Number six will be replace fee-for-services.
That's number 6.
Number seven will be to increase quality versus quantity of medical services. Number eight will be to add more consumer benefits and protections. And finally, number nine is other issues dealing with the ACA wants to strive to make the general population healthier by emphasizing prevention and wellness. They want to promote assisted living, long-term care, and improve efficiency and reduce costs. The ACA is now larger than the Bible. It has 2,700 pages in the original act that was signed into law in March of 2010, and presently has 13,000 pages of regulations. And as we know, they haven't even started documenting most of the regulations to the ACA. There's 6,000 proposed new regulations. And that's a considerable amount of time and effort that's going to be put into dealing with the ACA. The Affordable Care Act, regardless of popularity and the federal and state budget constraints, which are continue to be a source of controversy, it's estimated that most states will agree to accept the Affordable Care Act Medicaid expansion. From a historical view, the Social Security Act of 1936 was voted in the House by a margin of 372 to 33. The Senate voted in the SSA by a margin of 77 to 6. In 1965, Medicare was voted in by the House by a popular vote of 313 to 115. In the Senate, by a vote of 68 to 21.
So 313, 115.
Yeah. Senate was 68 to 21. Now, I have all this documented. You can go to our website to get the information.
Okay, so it's all there, okay.
Okay. Interesting enough, the Medicare law of 1965 was ratified by 6 states in 1965. It took 17 years for all 50 states to ratify the Medicare Act. So we can gauge the popularity of the Social Security Administration Act and the Medicare Act by the popular vote in both the House and the Senate. In 2010, ACA was voted in the House 219 to 212. Now that's only by a slight margin of 7 votes. In the Senate, it was voted in by a margin of 56 to 44. So it was, again, a slight margin of 12 votes. So many of the provisions of the Affordable Care Act will become fully operational and change everything we currently understand about the healthcare delivery system within the next several years. Regardless of the controversy, the Affordable Care Act will become fully operational. It is the law of the land. Many of the fundamental changes to the healthcare delivery system are underway, and many of the changes have yet to be set into motion. Again, it's going to take a considerable amount of time for this act to become fully operational. The ACA, many of the provisions put forth in the new regulations may be delayed or completely halted due to political and legal challenges. We continue to see resistance to the Affordable Care Act from individual states, individual state governors, and even Congress. The first bill that was proposed to Congress this week by the new Congress was a bill to repeal the Affordable Care Act. The Supreme Court decisions of June 2012 and public acceptance or resistance to participating in part or all of the ACA regulations is a prime example of the challenges from a political and from a legal point of view. The greatest legal challenge to the Affordable Care Act was brought forth by 26 individual state governments challenging the constitutionality of the Affordable Care Act. In June 2012, the Supreme Court of the U.S. ruled on legal cases brought by the 26 state governments.
What year was that?
That was 2012. That was last June. Okay, the Supreme Court decision was written in 2 parts. One decision was viewed in support of the Affordable Care Act, and one decision was viewed as a victory for the 26 state governments. So, the Supreme Court decisions tended to splinter the effectiveness of the Affordable Care Act. One decision was viewed as a victory for Affordable Care Act. One was viewed as a victory for state governments. And we're going to see how it's going to affect the Affordable Care Act and the institution of it. Okay. The number one decision dealt with the individual mandate. Now, in June 2012, the Supreme Court voted by a slim 5-4 majority vote that the individual mandate was constitutional. The decision was based upon the federal government's power to impose taxes. This decision by the Supreme Court was a tremendous victory for those who supported the Affordable Care Act. Now, we all remember that the decision came down in the last week of June last year. They made everybody wait for their decision. And again, it came in two parts. Number one was the individual mandate, and we're going to define what the individual mandate is and review that in just a minute. The individual mandate was viewed as one of the essential components that provided structural support for the entire Affordable Care Act and the changes proposed to the healthcare system. Now, the individual mandate is actually what provides the strength of the support of the act and finances a significant portion of the Affordable Care Act. The individual mandate is a central mechanism which provides financing from the multitudes of non-insured, low-risk citizens and support and acceptance of large domestic industries necessary to provide operational support and financially subsidize the Affordable Care Act. Okay, the second part of the decision of the Supreme Court in June 2012 dealt with state exchanges. These are the insurance exchanges. These are the way that that these non-insured people are going to get their insurance. The Affordable Care Act required all individual states to expand Medicaid coverage to all citizens within their state borders, or risk losing federal matching funds that presently pay for over 50% of the Medicaid cost of each state. The Supreme Court ruled by a margin of 7-2 that the federal government could not require individual states to expand Medicaid coverage within the state borders against their will. Justice John Roberts stated that the federal government could not put, this is a quote, a gun to the head of individual states. Chris Christie, governor of the state of New Jersey, stated he was happy to see extortion would not be allowed by the federal government. The court's ruling, the individual mandate, is seen as the constitutional endorsement of this portion of the Affordable Care Act. However, the court's refusal to rule in favor of the state exchange portion of the ACA severely weakens the effective power of the ACA and limits the financial attraction to states to expand Medicaid programs and coverage of individual citizens within the state's borders. The federal government currently pays, on the average, 57% of the cost of current Medicaid coverage in each state. Now, this is presently, or before ACA was enacted. Again, the federal government currently pays, on the average, 57% of the cost of current Medicaid coverage. As a financial incentive for states to adopt the Affordable Care Act, the federal government has agreed to pay 93% of the cost of newly eligible state Medicaid enrollees covered by the federal government from the year 2014 through 2020. Now, newly eligible, we will define that soon, but basically it's the new people who are coming into the Medicaid system. They are people who will be newly qualified to participate in Medicaid. Now that, roughly, that is anybody who is, whose yearly income is 133% of what the government considers the poverty level. Now in 2010, the poverty level was approximately $29,500. And 133% of that is close to $40,000. So if you were making $40,000 or less, you could qualify for, to be a newly eligible Medicaid enrollee and have the government subsidize your insurance 100%. On the other end, the government has agreed to subsidize insurance for people who are up to 400%, who make up to 400% of the poverty level defined by the federal government. And again, the poverty level is $29,500. The individual states will be required to fund the other 7% cost of newly eligible Medicaid recipients during the period beginning 2014 through 2020. This is obviously a much higher federal funding level for newly eligible medical recipients than what is traditionally the 43% that the federal, the state governments have to match with the existing Medicaid enrollees. The Affordable Care Act has not addressed what the federal government and the state government's responsibility will be for newly eligible Medicaid recipients after 2020. Again, the Affordable Care Act does not address what the federal government's and the state government's responsibility will be for newly eligible Medicaid recipients after 2020. Okay, so many governors have expressed concern about three major points of the Affordable Care Act. They are concerned about, number one, state exchanges for individual mandates. Number two, what they call the woodwork effect. Number three are old eligibles, or people who are presently eligible for Medicaid to be qualified for Medicaid enrollment, but are not enrolled in Medicaid.
What was the second one now?
The woodwork effect. Okay, these citizens will be eligible to participate in Medicaid programs as old eligibles, for which the government will be responsible for the traditional 57% and the state will be responsible for 43%. In other words, the state governments are concerned that once the ACA is implemented at the state level, there are going to be a lot of people who were eligible for Medicaid enrollment prior to ACA being adopted will come out of the woodwork and become will enroll for Medicaid. Now those people, the government will be required to, will be responsible for a traditional 57%, the state will be responsible for 43%. And that concerns a lot of the state governments. Rick Perry, governor of Texas, and Rick Scott, governor of Florida, have raised legitimate concerns about the federal government's ability to maintain its responsibility for funding the 93% for Medicare recipients after 2020. And this is for newly eligible Medicaid recipients. Again, Rick Perry and Rick Scott are concerned about the federal government's ability to maintain its responsibility for funding the 93% for Medicaid recipients after 2020, much less its ability to maintain the responsibility for funding 93% for the Medicaid recipients during the period 2014 through 2020. And this is based entirely upon the present entitlement spending and deficits that we presently that's presently encountered in Washington, D.C. And that's been obviously a subject of much concern and much debate over the past several years, but especially right now, with $16.5 trillion in debt, people are starting to wonder where all this money is going to come from. And some states are concerned that they're not going to be able to count on the federal government to fund the 93% of the newly eligible people, much less continue to fund the 57% of the people who are presently enrolled or the old eligibles. Okay, so in the absence of federal subsidies for Medicaid recipients, the individual states will be responsible for management and financing of the programs. That's why many of the states are opting out of the state insurance enrollment as opposed to willing to participate in the state insurance exchange program. After 2020, the state responsibility for the newly eligible Medicaid recipients will revert to the traditional federal funding level of 57%. Now, Perry and Scott, their concerns were supported by an article published in 2010 in the New England Journal of Medicine by Ben Summers and Arnold Epstein, which supported the woodwork effect. According to the article, only 62% of the people eligible for Medicaid right now are actually enrolled and participate in the program. Well, what that means is there's 38% out there, or roughly more than 1/3 of the people who are eligible to participate in Medicaid may become old eligibles and may enroll in Medicaid system. Or conversely, less than 2/3 of the people eligible for Medicaid are actually enrolled now. So the states are concerned that there's going to be 38% that are going to come in as part of, who are going to realize that they can be enrolled in the Medicaid program. They're going to come in and they're going to enroll. The states are going to be responsible for those old enrollees, and are going to be responsible not only for them but the newly eligible people. Okay. So the participation rates in Texas and Florida are estimated to be 45% and 44% respectively. These are people right now who are eligible to be enrolled in Medicaid. This is in the state of Texas and the state of Florida. These are what they estimate are actually enrolled in the program. 45% and 44%. So obviously, Perry and Scott are very concerned about what's going on, and about Perry and Scott are very concerned about making a decision whether to participate in the state exchanges or not to participate. Rick Perry has stated that to participate in the insurance, the state insurance exchange is similar to putting 1,000 more people on the Titanic. We all know what's going to happen. They're going to sink. On the average, national average, only 25% of each state budget is used to finance Medicaid. With the budgets of the individual states at breaking point, some states With the budgets of the individual states at breaking point, some states are in more trouble than others. The strain of the enrollment and participation of additional Medicaid eligibles cannot be underestimated. It could make the program in and of itself topple at the state level. And of course, if the federal government cannot contribute what they've represented that they're going to contribute, then obviously the entire program will fail. So let's talk about the Affordable Care Act resilience and stability. You know, this previously we showed how close the vote was in Congress, in both Senate and the House, of the passage of this bill. It continues to be a center of controversy. The Supreme Court has made the decision, one in favor and one that is not in favor of the Affordable Care Act. But this act has as many lives as a cat. The Supreme Court ruling gave a green light to it moving forward, but it's moving forward slowly. And again, there's going to be continuing issues, continuing debate in Congress about the entire structure of it. Okay, so the resilient stability, the individual states have the power to refuse to participate in Medicaid expansion by refusing to set up state exchanges. However, this is viewed as a temporary delay and will not prevent the ACA from becoming fully operational. Later on in the program, I'm going to show you a map of which states have decided to participate in Medicaid expansion in the state exchanges and which haven't. That decision was made on, I think it was December the 16th. It was a Friday. The law continues as unpopular today as when it was signed into law by the President. Approximately 55% of the population favored repeal of the ACA in March 2010. So the majority of the population of the United States, when it was signed into law, did not like it. They wanted it